In trying to look at the pathways that actually provide energy for the red blood cell, um, you get to see that these pathways, they have a lot of enzymes that actually get to see that, okay, this pathway gets to completion and all that. All right, and one of the enzymes in these pathways is what is known as a pyruvate kinase. All right, so we're trying to look at the disorders of these pathways in situations where the enzymes needed for these pathways are not sufficient, so there might be problems arising. Okay, so for the conversion of phosphoenol pyruvate to pyruvate, one enzyme is needed, and that's the enzyme known as what, pyruvate kinase. So if this pyruvate kinase is deficient, it actually has some effect on the body, all right, and that's basically the clinical features. All right, so looking at this now, pyruvate kinase deficiency, you see that I've already told you guys the application of this enzyme. So it is actually one of the most dominant controlling steps in glucose metabolism, together with what, hexokinase and phosphofructokinase. That's like the enzymes that control one of the most important steps in glucose metabolism. So this pyruvate kinase is the most common enzymopathy of glycolytic pathway, inherited in an autosomal recessive manner, right? The red cells become rigid as a result of reduced adenosine triphosphate formation, right? The deficient pyruvate kinase leads to what? Accumulation of substrate further up in the pathway, okay? Including the 2,3-diphosphoglycerate, okay? Now, the increased concentration of these 2,3-diphosphoglycerates in pyruvate kinase deficient red blood cells will now shift oxygen dissociation curves to the right, and this will indicate that there's a low oxygen affinity. Right, so the red blood cells will not be um, carrying enough oxygen as it should. Do you understand? So basically, the person will be what? The person's cells will be starving. Okay, so there will be anemia. So there's a severe what? Chronic, that's clinical features now. There's a severe chronic non-spherocytic hemolytic anemia requiring repeated transfusions. So the person will be in a crisis, and always the person will now be opting in for what? Blood transfusion. All right. So there will be moderate hemolysis with exacerbation during infections or pregnancy to symptoms like compensated hemolysis with only a minor apparent anemia. All right. So the majority of the reported cases have presented in childhood. All right. Most people with this pyruvate kinase deficiency have presented in childhood. Okay. So now, because there is excessive breakdown of red blood cell, jaundice is usual. Okay. Sometimes severe neonatal jaundice and gallstones are frequent. All right, frontal bossing in children may be present because their skull is not well formed. Okay, so there may be frontal bossing. Then, if you try to palpate the spleen is enlarged. That's what is known as splenomegaly. Okay, if you check for their hemoglobin levels, it will be between 4 to 10 grams per dl. Right, that's anemic. If you do a peripheral blood film, okay, they'll have a normochromic anemia. That means they have anemia, but the blood cells are kind of like the same color with when there's no anemia. Though there'll be reticulocytosis. That means what? The red blood cells, they will be at the level of what? Reticulocyte, and will not reach to the level of mature red blood cells. Okay, and sometimes they will produce a slight macrocytosis. Okay. Anisocytosis is a variable portion of spore cells or acanthocytes which are not specific, particularly after what? Splenectomy, right? So, talking about the management of this pyruvate kinase deficiency now, there's no curative therapy for pyruvate kinase deficiency, sorry, okay? And the treatment is therefore based on supportive measures. Red blood cells transfusion may be required in severely anemic cases, particularly in the first years of life. Okay, splenectomy may alleviate the anemia but does not cure it, and is indicated in those patients who need frequent transfusions. Right? As with all chronic hemolytic anemias, folic acid of about 5 milligrams per week or 400 micrograms daily is useful supplement. Okay, iron chelation, since iron overload is common in pyruvate kinase deficiencies, is helpful too. All right, bone marrow transplantation has been successfully performed in a very few severely affected children. Okay, so basically they need red blood cells back functioning properly. All right, so I think that's where the goal of management of this condition actually aims at.